is our Medical Reserve Corps COVID-19 MRC mass vaccination overview, and we're so happy to have you all today during this lunchtime hour. This will be our lunch and learn format. So if you can go to the next slide, please. So just a little bit of housekeeping to go ahead and get us started off. So please make sure to keep your lines muted. We have muted them for you so far today, just because we have a few hundred people usually joining us during the lunchtime hour. Also, any questions that you have, go ahead and put those in the chat box. So we're not going to be using the Q&A feature just because it's a bit difficult for us to manage both in our history. So as well as just make sure that if you don't want to be sharing your video, make sure to click on the three dots in the corner of the frame where your video is, and make sure to unshare that or to stop your video if needed. And otherwise we will get going on today's training. So to kick us off, I'm going to introduce our presenters. So first of all, we're going to have Marshall Vogt start off with a video. I do want to mention that this video was recorded in January, so there may be a couple of things that have changed or are a little bit different, and we'll make sure to cover over those as needed throughout the presentation today. But Marshall Vogt is our COVID-19 vaccine operations section lead. He's a very busy man right now, and he took some time out to create a video for us to kind of introduce some of the intricacies of the COVID vaccination that we'll go over. We also have Leem Abdelaziz, and she's our COVID-19 MRC Medical Surge Coordinator. She's a SME expert in terms of PODs, so we're going to be really utilizing her brain trust when we get to that section. And then myself, my name is Megan Doran, and I'm your Virginia Medical Reserve Corps COVID-19 Coordinator. So we'll be talking a little bit more towards the end about specific questions that you may have regarding the COVID-19 vaccination. So feel free to hold those towards the end of the presentation, and then we'll make sure to go over a lot of those. So next slide, please. So just a little bit about what you're going to learn today. So after this session, you should be able to explain some state and local dispensing systems. We're going to talk about point of dispensing operation structures, or what we like to coin the word POD, so for point of dispensing. And then we also have a review over the COVID-19 vaccination distribution campaign, and also the roles of volunteers during our mass countermeasures, or our medical countermeasure operations, rather. So next slide, please. So with that, we're going to go ahead and start everything off. I'm going to let Lean kind of speak to our next section. And first, we're going to show a video from Marshall Vogt. So give me just one moment, and I'm going to share my screen with you. Please stand by.
Today, and thank you for letting me talk to you a little bit about what you are going to be helping to volunteer with, and we appreciate you helping to volunteer with this massive vaccination effort that Virginia is undertaking for COVID-19. My name is Marshall Vogt. I'm an epidemiologist with the Virginia Department of Health Division of Immunization, and I'm the operations lead for COVID-19 vaccination within the COVID-19 vaccination unit here at VDH. So we've been working very diligently over the past few months to plan for the arrival of vaccine in Virginia, as well as to plan how to get vaccine out to local health departments, to hospitals and healthcare systems, and to other providers, and to get that vaccine into people's arms. And again, you as MRC volunteers are critical components of our vaccination campaign. And so again, I thank you for all of the work that you're willing to do and all of the work that you will do as we take on this mammoth task. As you can imagine, vaccinating people is something that we do every day in public health, but to vaccinate so many people in such a short period of time poses a lot of logistical challenges. we know that there are several delivery methods that we can use for COVID-19 vaccine. And so we're trying to take advantage and continue to update our plans and revise our operational strategies here in Virginia to take advantage of those. And those are hospitals and healthcare systems, pharmacies, private providers, local health departments, and then mass vaccination clinics, sites where we could have a large number of people come while still respecting social distancing, of course, and receive a vaccine. And what's complicated about this is that it's a lot different from how we've done mass vaccination, say, for flu clinics or even during the H1N1 pandemic. One, we know that COVID cases are continuing to surge across the state, and so it makes it very difficult to deliver vaccine when we already have a very stressed healthcare system, and many of the people that would be delivering vaccine are healthcare providers that are helping to take care of COVID-19 patients. In addition, the two leading vaccine candidates that we have right now require 2 doses, and they can't be interchanged, which means that not only do we have to get people to come to us once for a vaccine, we have to get them to come back within the right period of time and get the same kind of vaccine product again. And of course, it's very difficult to get a large number of people together and administer a vaccine when we know that COVID spreads very easily, especially in closed environments where people are not able to socially distance from one another. There's lots of challenges for the COVID-19 vaccination program, but we know that it really is the key to ending the pandemic, and we're committed to working together to get vaccine to Virginians and people across the United States and across the world in order to stop this pandemic. You've probably heard about a couple of the vaccines that are being used for COVID-19 vaccination. Right now in Virginia, we're using 2 vaccines, one made by Pfizer and one made by Moderna. They're very similar vaccines in terms of their mechanism of action, but they differ a little bit in terms of their storage and handling and dosing and spacing. But they all use what's called mRNA technology. mRNA stands for messenger RNA, and it's something that basically tells our bodies how to make specific proteins. Think of it as almost a stack of copy paper in your body, and your body reads that and it prints out proteins based on what the mRNA says. We do this every day in our cells and our bodies, but the vaccine takes advantage of this technology by actually telling our bodies to produce certain proteins from the COVID-19 vaccine. So when you receive the COVID-19 vaccine, your cells receive a small piece of messenger RNA that codes for the spike protein on the outside of the COVID-19 virus. Our body's cells take in that RNA, and then they produce that protein and release it out into our bodies, where our immune system mounts an immune response to it. It works on the same principles as many other vaccines. It's just that our bodies produce the antigen, that protein that stimulates the immune response, internally instead of pre-prepared antigen being injected into us. These vaccines are safe and they are effective. They've gone through the same amount of rigorous research and clinical trials that all other vaccines go through. It's just we were manufacturing them at the same time so that once those research studies ended and we knew that the vaccines were safe and effective and they were authorized for use, they were already manufactured and ready to start being released, distributed, and administered. mRNA vaccines are not going to alter your DNA. And really the only adverse side effects that have been reported are symptoms that typically occur when your immune system is working and responding to something and trying to build an immune response. That might be fever and fatigue, sometimes achiness or soreness at the injection site. But these are very minimal symptoms. They don't last very long. And they're really a sign, again, that the vaccine is working. And more importantly, it's worth just a couple days of feeling fatigued or having a sore arm as opposed to taking the risk of getting COVID and becoming seriously ill. We know that these vaccines are the best way to beat the pandemic, and we're excited to start getting them out to people. Now, as I mentioned, there's a lot of people that need to receive vaccine, and we don't have tons and tons of vaccine yet because we're still manufacturing it. So we really had to think about how to prioritize who gets vaccine when and why they need to get vaccine. The federal government, Operation Warp Speed, the Advisory Committee for Immunization Practices at the CDC, they met and determined some phases and different criteria for people to be able to receive the vaccine. The phase 1A, or the very early vaccine recipients, include healthcare workers, those that are on the front lines of the COVID-19 fight, as well as those that live in long-term care facilities like assisted living facilities and nursing homes. That's because those individuals are very vulnerable to COVID-19 and poor health outcomes, including, unfortunately, death due to COVID-19. Phase 1A individuals have been receiving vaccine for the past couple of weeks. And in fact, some individuals are already getting their second doses, meaning that they're fully immunized against COVID-19. And we're excited about that, but we know that there's more work to do. The next phase, or phase 1B, will include individuals that are 65 years and older, frontline essential workers, and those aged 16 to 64 with underlying medical conditions. That's because this next group really comprises a group that can be at risk, like those that are 65 plus or with underlying health conditions for adverse health outcomes due to COVID-19, or folks like essential workers that are constantly exposed to COVID-19 because they can't work from home or really practice social distancing. We're working right now to refine our plans because the phase 1B priority group was changed a little bit from what it was originally with the addition of people with underlying health conditions and the expansion of that age from 75 plus to 65 plus. As more vaccine becomes available, we're getting it out to more providers. Remember, initial vaccine really took place, or vaccination really took place at hospitals and local health departments. But now we're starting to see other healthcare providers being able to receive vaccine, as well as pharmacies receiving vaccine. And in fact, many of those pharmacies are the ones that went in and vaccinated people in these long-term care facilities. So as we get more vaccine out, and we're looking at those different avenues for vaccine administration, like pharmacies, like these mass vaccination sites, soon we'll be able to really ramp up the number of vaccinations that are being given here in Virginia. We've set a lofty goal of about 25,000 per day by early February, and we know that we want to scale up even more to about 50,000 vaccines per day. In order to do that, we're going to need more vaccines, more sites for people to go get a vaccine, and volunteers such as yourself to help augment our public health provider force in the community. Once we're well into phase 1B, we'll start to look at the next phase, which is 1C, other essential workers. Folks that keep our country working. They keep the lights on, they keep our infrastructure working, but they're able to maybe work from home or socially distance a little bit more, so there's less of a risk for them being exposed to COVID-19. Those folks are in the next phase, what I said was that 1C phase, and we're going to be turning our attention to them as soon as we're able to. After that, we'll start to open up the vaccine to others in the population who are interested in getting it. It's not going to be mandatory here in Virginia, nor is it likely that the vaccine will be mandated anywhere in the United States by the government. We need people to trust the vaccine, trust that it works, and feel safe that they're getting the vaccine and confident and that it's going to help end this pandemic. You are ambassadors as our MRC volunteers and can help answer questions and allay concerns. And we're excited that you're here to help us do that. Thank you so much again for volunteering and for learning so much about this vaccine so quickly and how we're going to administer it to folks in order to get out into the field and start vaccinating people. We appreciate your help, and we couldn't do it without you. Thanks so much. Be safe and be healthy.
So again, that was Marshall. He works with our vaccine unit at VDH, and we so appreciate him sharing that with us. Again, some things may have changed slightly, which we'll make sure to go over. But now I will hand it off to Lean so that she can talk to us a little bit more about point of dispensing in our overview.
Thank you, Megan. Good afternoon, everyone. I really appreciate everybody's today coming in and during their lunchtime. So I'm going to give you a little bit of an overview. When we say pod, we've been saying pod, but really I'm going to take a little bit of step back and talk to you a little bit about what is a pod, which is a point of dispensing. My name is Lina Abdelaziz, and I'm an MRC Medical Surge Coordinator here with Virginia Department of Health. Next. So what's the point of dispensing? What were we going to learn today during this presentation? First, we're going to understand what public health emergencies mean and what type of public health emergencies are required to open a pod, or we call it pod activations. We're going to describe the types, the purpose, and the functions of pods. We're also going to talk a little bit about pod operations, the function of pod groups, roles, and responsibilities. and your role as well during this mission. Next. So responding to public health emergency, what do we mean by that? The public health emergency, when we respond to it, it's the ability to provide medical countermeasures in a support of treatment or prophylaxis to identified population in accordance with the public health guidelines and or recommendations. Meaning that when we say that we're active or we want to respond to a public health emergency, we mean by that we want to provide medical countermeasure, either pills, or we give vaccines to the public or to the identified population. With COVID-19 is a little bit different because we consider everybody is required to be, or we can give them the vaccine. Next. So what are some of the dispensing scenarios? We have two types of scenarios. We normally either there is a public health event, natural occurring diseases, or novel or emergent infections, like for example COVID, or sometimes there is a man-made incidents that we need to be proactive and activate those spots. So for example, we have bioterror attacks, small or large scale. We consider them also our public health emergencies that we have to be ready and to respond to and open those points of dispensing. If you guys remember the letter of anthrax that we received in Washington, D.C. through the mail, so that's, we consider it a kind of small scale because it's only affected a certain population, a certain groups. Next. So public health emergency that might require a point of dispensing activation, the anthrax, plague, smallpox, pandemic, or any emergent infections, these are required by the federal government for us at the state level and localities to plan for. Yes, we understand some of these might not be in the population right now, but these agents that CDC or the federal government called it Category A, meaning these are highly infected, and that we require as state and localities to plan for it and be ready in case that something happened. Next. So this is a response time in general. Normally, I just want to kind of go through this so you can understand where we start and how the pod start operation. So normally, an incident occurs. Here, I'm talking from the left to the right. So an incident occurs, then a decision, normally by the health director of that locality. Let's say, for example, the incident happened in Fairfax. The health director of Fairfax decided that they made a decision to dispense countermeasures. Then they reach out to the state, and we at the state level start mobilizing logistics. We reach out to the federal and ask them and let them know about the incidents that is happening. And then we start rostering staff. Those staffs are the state locality health staff, but also the MRC. We start deploying pod kits. We normally have a location that we decided this is where we're going to open the pod. We start sending those logistics, and then we staff the pod and we start staging, meaning we started putting things in place so we can get the pod open to the public. We ask employees and MRC to be deployed and ready at the pod. And then we receive what we call it SNS, which means Strategic National Stockpile. That's the term that the federal government use when they send stuff. They send it from a cache called the Strategic National Stockpile. They deliver it to us at the state level. We deliver it to locality, and the pod open. All what you see right now, it's actually 48 hours operation. From the minute that the decision make dispense countermeasures to the minute that we open the pod, it's normally 48 hours. This is a requirement by the federal government, and at the state and locality, we plan for that we will be open and ready within 48 hours of an incident. Next. As I said earlier, the health department operation, the incident commander normally is the health director of that locality. So each health department, each locality, the health director, we play as the public health incident commander. So they normally initiate the unified command. They request support from any cooperating agencies. This is a huge mission. A health department cannot do it by themselves. So we normally reach out to the different partners in the community or at the state level, even at the federal level, to help us dispense the large population. And then the health director determined the dispensing protocol. As we go moving forward in the slides, you're going to understand there is different type of dispensing protocol that we follow, and I'm going to discuss that later. Next. So what's a pod? We've been saying pod. Point of dispensing, that's what pod stands for. And it's actually a fixed identified public facility in which medical countermeasures, we call it MCM, are given to the people in a response to a public health threat or emergency. So those places where we call it pod is already fixed and identified. We don't run last minute to find where we can open a pod. These are planned, well planned. We reach out to pod, to, as I said, organization around the community, if it's gymnasium, universities, high schools. We work with all these different partners to determine what is the best fixed place that we can identify as a public facility for the public to come in and get vaccinated or get their pills. So the primary goal of a pod normally is triage and Medicaid, and then a secondary behavioral health and record keeping. And we want to, the purpose of a pod, we want to decrease the number of individuals that might get ill. So in a pod, we don't treat people who get ill. We actually make sure people, the public are exposed. Probably they're exposed, but they're not sick yet. So we want to make sure that they're okay. So that's why we give them the medical countermeasures. Next. So the difference between a pod and a clinic, you probably by now figured that out. A clinic, it's very individual focused. And when you go to a clinic, they go through your medical history, they take your exams, they check your records. It's a little bit of time consuming. And then if you need further evaluation, they normally send you to another medical professional or to the hospital. And that's what we call it the traditional healthcare settings. The pod is a little bit different because no exam, and we have very limited records. We just ask people to fill out a form to get their demographic information, to get a little bit of medical history if they have any allergy to any kind of medication, things like that. So it's very quick and it's population focused. We want to get the pills to many people as we could, or we want to vaccinate as many people as we could. Also, we process the client as quick as possible. We normally process thousands of people throughout a pod a day. And it's a very community-based, non-traditional healthcare setting. As I said, we normally have it in a school, in a gym, in a university gymnasium, in a parking lot. So it's not a traditional healthcare setting. And it depends. We have a medical pod and we have non-medical pod, and we normally use regular traditional staff or MRC volunteers who are medical or non-medical. Next. So as I said, we have two dispensing modalities or two dispensing pod scenarios. We have what we call it first, non-medical pod, meaning that we only give pills in that type of pod or antibiotics, and we don't require a medical license. Anybody can be a volunteer or a staff that they can pass those antibiotics, and we normally dispense it to the head of the household, meaning the head of the household can come in, we give them one form, they fill out that form and they put how many people they have in the house, and we give them the medication. They even can fill out for the neighbors. If they have an elder neighbor that they can't come and pick up we can give it to them, to the head of the household. And it's a very, we don't have a lot of forms when we give antibiotics. We just want to give as many as we could to the public if we feel the public is exposed to certain disease that they need that oral antibiotics as fast as possible. The medical pod is a little bit different. It's normally vaccine. And for the vaccine, you can imagine it needs a medical license required, and everybody must be in the pod to get vaccinated. Next. So what's the difference between the role of state and localities? You can imagine there is so many things that we do behind or throughout the year that we plan for and to be ready for things like that. So at the state level, we normally, if we get the shipments of vaccines or medications, we normally receive that shipment, we unpack it, we store it in our own warehouses, we secure it, meaning that we have a security plan that we normally activate with the state police or local law enforcement. And after that, we distribute that to the local jurisdictions. We send it to the local health department, we send it to healthcare settings and other state governments departments as well. And then we normally also responsible for the public information and communication to the public. We want to inform the public, we want to let them know what's going on and how they can be ready and when they can get the vaccine or the pills. Locality, they normally receive, they secure and dispense the necessary MCM, which is medical countermeasure, to the public in a timely and efficient manner. So at the state level, they receive and distribute. At the locality, they secure and they dispense. So locality is the one who is responsible to dispense either medication or vaccine to the public. And also they're responsible for public information and communication. They want to communicate to the public where they can go get their vaccine or where they can go get their pills or any information about that certain disease. Next. So we have some POD operating policies. For normally non-medical POD, we don't require photo ID. And we just have minimum requirement that we ask, the full name, date of birth, their address, and if they have allergy, things like that. We have some media policy. We normally, we don't allow the media to access POD, or we give them permission to enter it in in a certain time, and they can step in the side and we can answer questions to them. Next. So this is a question for you guys to start thinking. What's the difference between a closed pod and an open pod? Now you understand what is a pod, but there is a difference between a closed pod and an open pod. You can get your information. You can answer that in the chat.
All right, so far we have public versus private, and then someone's asking closed needs to attend an appointment to attend. And then someone is saying, let's see, closed pod is appointment only, appointment based for closed. So that's kind of what we're getting so far, Lee.
These are all correct answers. Next, I can explain to you guys more detail. So the closed, or we call it the private pod, is normally used the resources of a partner organization to set up a pod and dispense MCM in their own facilities. Meaning, a hospital, for example, that's a closed pod, because us at the state level, we send the vaccines, like for example, now with the COVID-19, we send the vaccine to the hospital and we step aside and let the hospital handle that with their own resources, set up the pod, get their own people and their families, their medication or vaccines. Another example also, we have some MOUs with the military base here in Virginia. We normally send them the vaccines to the military base. They can vaccinate their own people and their family of those people who live in the base or outside the base. So all we do, we just ship the vaccines, and that's what we call it a closed pod, because it's closed, meaning that it's own private people, they get into that pod. Like right now with COVID-19, you can tell there is phases and we're doing with certain population. So this is actually an example of a closed pod. You need an appointment for it, that is correct. And also it's dispensing or giving the medication to certain population in a closed private and using the resources for that particular organization. And then another example, the jails and correction facilities, we normally send their vaccines to them or their medications, and they dispense it to their own people using their own employees, or they can contract with nurses outside, wherever they do. All is responsibility at the state level, we send it to them. The open pod, it's open to everyone, no restriction. Anybody can go in and get vaccines or get their pills, and is normally located in a pre-identified community-based facility that public health agencies can activate to serve the general public. So open pod, remember, open pod is for the general public. Everybody can get in. Closed pod is a certain population, and it depends, that population with who they're gonna vaccinate or give the medication to. Next. So here, example of a closed pod, I already kind of mentioned them. Government example, department and jails, like for example, Department of Social Services, Department of all the different departments of the government, they can ask for that. They can ask, hey, can we receive our own vaccine and vaccinate our own people in a closed pod, which is meaning in their own facility. And these are examples, the hospitals, the churches, big companies. We normally ask a company to be 50 employees and more to get into this closed MOU with the close pod with the state. And as I said, also open pod, these are sites include public schools, sports arena, gymnasium, community centers. Sometimes you have drive-through pod, and then mass vaccination clinics. And also we have some contracts with some pharmacies that they can play as an open pod. So we send the vaccine to the pharmacy, public can go into the pharmacy and get their vaccines as well. This is considered an open pod. Next. So the pod operation, as I said, the primary goal is triage, medicate, and educate. As I said, we don't treat in the pod. We normally medicate, give them medication or and educate about, we have normally brochures and information about the certain disease that we give it to the public. The pod operation start at the beginning with the greet and screen. People come in, they need to be greeted, screened, and with the COVID-19, they probably get their temperature and make sure they don't have any signs of symptoms of COVID-19. We give them the form, they fill it out, and then after that we review it, and then we either dispense the medication or vaccinate. It depends on the pod. So these are I'm going to go over different roles and responsibility throughout a pod. So pod command staff, these are normally at the top. They manage, coordinate, and consult an overall of the MCM pod side functions. That include operation, liaisoning between the different divisions, public information, security, safety, planning, logistic, and administration. And that particular person, they normally report, or people, they normally report to the emergency planner or the health director. Next. Command staff, their responsibility is direct all dispensing operations. They coordinate with partner agency at the pod side. For example, if they decided to activate a pod in a school, they probably contact that local jurisdiction, the local high school or whatever, to make sure that they're ready. We already have planned with them. We already train with those different pod sites. So it's not going to just give a call a day of the pod activation and be like, hey, get the school ready. No, we've been planning this for, I think now since, it's probably since 9/11, we've been planning this. So we have contract with the schools. We have different gymnasium, different universities. They know who we are when we pick up that phone call and let them know we're ready to activate your side. We already been training with them, exercising and active and kind of being ready for this type of thing. So as I said, the command staff coordinate with the partner agency. They communicate also with HDOC. HDOC is the Health District Operations Center, where they manage and coordinate the operation, or the EOC, the Emergency Operations Center at the state level. Also, they act as a resource for pod staff. If you have any question in a pod, you can go to your command staff and ask them. They manage a small incident that occurred during the dispensing operation. Any issue happen, any small accidents, anything, they manage that. And they ensure the safety of the pod staff and clients. Our number one role and responsibility is to make sure that you're safe and the staff are safe and the clients who come in through the pod are safe as well. Next. So the safety officer, that's another position, or biosafety officer. The MRC coordinator can play this role if you have a background, if you're a nurse, if you have a background in safety in general, or you worked in that capacity before. They normally monitor the clinic operation and advise the clinic point of dispensing supervisor in all small relating matters that relating to safety. That include the health and safety of the clinical personnel and the clients, and also they assess and anticipate any hazard and safe situation during the pod operation. If they see anything, if they see some people might fail, whatever it is, they can assess the situation and make sure everybody's safe. That person or that particular, they normally call it, as I say, the biosafety officer or a safety officer. They normally report to the pod manager or the clinical supervisor. Next. So pod unit leaders, so we have different units within a pod. They have leadership. Each unit has a leadership or a supervisor. Those names don't get a hang on it because they change. So each pod has a different operation, but I just want to give you an idea of overall what the different roles that you can see. So the unit leaders, we call them unit supervisor. They normally oversee the operation of each unit or a team. They normally have a team under name. They give briefings when you come into that team. Let's say you work in a biosafety team. They give you the briefing. They update you and let you know what's going on with the operation, and they ensure also the safety and the well-being of everybody in their team. That particular person or that particular unit leader will report to the command staff or the emergency planner, or he can report directly or she to the health director. Next. So what's the responsibility of unit leaders and supervisor? I kind of mentioned it a little bit. As I said at the beginning, the safety and welfare of everybody. They oversee the operation of that particular unit, and they give briefing and update to their staff. They ensure also the staff they receive adequate breaks and rest, and look for any PPP exhaustion. They also ensure the staff records and time appropriately. They record everybody's hours, and they make sure that you take enough break, you get the food that you need, and they make sure that your safety and well-being is okay. Next. So this is an example of a POD ICS structure. You can see at top the POD manager. You can see either we call it a safety officer or biosafety officer. Sometimes in some POD there'll be two. Somebody will be responsible for overall safety, and somebody will be just responsible for the clinical, which we call the biosafety. They all report up to the POD manager. On the left, you can see a public information officer. We call it PIO. They're normally responsible for handling media. If anybody outside they have a question, they normally handle that. And that's normally a person who works at the health department, because they train and they know how to handle media and how to handle questions from the general public. You'll see that person report directly to the POD manager. You can see at the bottom, these are different unit supervisors. It could be more than this. It could be 10, 12 units. It could be just 2 or 3. It depends on the size of the POD. A POD can be open to 100 people. Some POD can be open to 5,000 people. So it depends on the operation and the side of the POD. This ICS structure, which is ICS stands for Incident Command Structure. That Incident Command Structure can grow or can get smaller. It's very flexible and adaptable to the operation. Next. This is another role that an MRC can play, which is a COVID vaccinator. That's what we call them. That person particularly prepares and administers vaccine to the client. It's very simple. They prepare the vaccine and administer it. That person will probably report to the POD manager, unit leader, if they have a unit leader, or a clinical supervisor. It depends where how that ICS structure is written. So vaccinator support or a medical evaluator. It could be one person who's doing both. It could be two people. One is vaccinator support. The other person is just medical evaluator. The description for that or these two positions, they ensure the client receive the proper screen. They make sure those forms that I mentioned earlier are filled out correct and they're getting the right vaccine. And they, based on the medical evaluation protocols, and also they collect and process all patient registration and evaluation forms. They record the time in and out, and that particular person might be reporting to a POD manager, a unit leader, or clinical supervisor. They also, is not mentioned here, but that medical evaluator for vaccines, for example, after everybody's getting the vaccine, they sit in the side in a waiting area. That medical evaluator normally is there to see if there's any signs of anything. They kind of look and wait and see if the clients are doing okay before they let them go. Next. So example of a POD ICS structure here for the clinical, you can see it at the bottom there. I mentioned vaccinators and vaccinator assistants or a medical evaluator. Sometimes it's one person, sometimes two in each position, sometimes 10, sometimes there's only two positions, sometimes one position. So as I said, it depends on the POD operation and the size of the POD. Next. So this is a question for you guys to think about. I just want to say that I see a lot of questions on the chat. Once I finish my presentation, I'll stop and answer those questions. And then any question about the vaccine, that's Megan is going to cover after me. So this is a question for you guys to think about a little bit. Can you think of any support role or roles to the POD mission beside the one I mentioned? Can you guys think of anything else? You can write your answer in the chat.
All right, so we have the logistics, security, parking assistance, checking people in, which I think we would call a greeter, flow supervisor, flow control, trying to get these quick, check-in, interpreter, runner, transportation.
These are all correct. There is these are all roles actually within a pod. That's great. Next. So as some of you mentioned, the logistics support is very important. That particular position, they normally organize, direct, and coordinate operation associated with occurring and maintaining the facility, the personnel, and the equipment to support that point of dispensing function. That particular person will report to logistics supervisor. Sometimes if there is no supervisor for logistics, they report directly to the pod manager. Next. You can see the logistic over there and all the way to the left. You can see that it could be a runner, they could be an IT, they could be somebody who is responsible for the food, it could be somebody who's a flow, or the flow could be with another unit. So logistic, it can cover so many positions and so many people can work under that particular unit. Next. So the admin support is very critical to the pod operation. So many names that you can find, so many roles as well in the admin support. You can find something what we call it the vaccine controller, a fillers, a screeners, an assistant, floaters. I mean, those people are all responsible for the admin side of the pod operation. They review and screen the form. They assist the vaccinators by preparing the appropriate type of vaccine. They probably report to the pod manager directly or to the support service unit leader or the flow or traffic unit leader. It depends where they're sitting and how, as I said, how big that pod or that particular operation. Next. So this is some of the admin or a greeter or screener. They normally, this is an actual picture for one of our pod. They sit by the door, they make sure they greet the clients, they take the temperature, symptoms, they see if there's anybody who's sick, they direct them to the right place, probably a hospital or sometimes we have some EMS provider on site, sometimes we have an ambulance on site to make sure that if anybody really sick, they can transfer them to the hospital. They also, that person or that client, greeter, screener, they're normally responsible also to address any such, any needs for the clients, such as physical, language services, any barriers that we feel that client or that help support that they need, that greeter or screener look for those and ask if there's anything that we can do to help smooth that client experience. Next. The form distribution review unit is normally the next unit after the greeter. These, as I said, those pictures are for real pod pictures that these are some MRC volunteers and some of our staff. So the client, form distribution review unit, they normally record the time in before when people start coming in. They hand out the forms for each client. They answer any client question. They review the form and record time in and out. They monitor the clients who require additional assistance as well. Just want to mention that for each of these roles, you can get additional training by your unit coordinator. So if you're assigned to a unit, let's say you're assigned to Alexandria, assigned to Fairfax, you have a unit MRC unit coordinator. They will see what type of training that you've taken. They will see your credentials and what role you can fit in, and they will assign that role to you. And if you feel like, for example, you've been assigned to this form distribution unit, they'll make sure that they train you on the form. They make sure you understand what the form. So when you have questions by the clients, you'll be able to answer that. So here I'm just giving you an overview, but definitely there is more training that you can learn from each of these roles. The flow and traffic control unit, this is normally play a critical role when we have an outside or even inside when we have sometimes drive-through operations. They normally manage and direct the traffic. They guide the clients, direct the client to outstanding questions. They prevent arriving clients from entering through exit doors. They address the needs as well. Next. You can see here in an incident command structure, the location where these positions sit in. You can see the critical supervisor over there. They're responsible for the form. You can see the flow control supervisor. They have flow inside, flow outside, the greeter, screener. So they have, as I said, it could be one people, it could be two, it could be three, it could be a bunch of people they're working in that position. Next. So interpretation and special accommodation. Some pods, they have that. Some pods, they don't. Normally, that person assists non-English speaking clients with understanding their information and the process of pod. They interpret information between pod and staff clients. Sometimes we have, as I said, people do that. And sometimes we use language line to help clients if they have any question and we can understand their language. We also that person also identify any accommodation needed for vulnerable population, such as children, older, access and function needs, hearing and visual impairment. And that particular person will report to a support service unit leader or a pod, or can they report directly to a pod manager. Next. So you can see what they're sitting, support service all the way to the right. Sometimes there's interpreters, sometimes there's an outreach education person, sometimes there's a consult. So it depends on the pod and the pod operation and what that particular pod manager decide to have. Next. So pod demobilization, what do we mean by that? So the operation ends, we have a 12-hour shift, we have a 10-hour shift, it depends on the pod. We decided that we demobilize that pod. Sometimes because the operation is ended, we finish all the vaccines. Sometimes it's just the time, even though we have enough vaccine, but we work 12 hours, we want to end the operation. And sometimes an accident happened, things happen and the pod manager decided to interrupt the operation and stop it. So at the conclusion of the pod operation, each pod manager would normally do secure the SNS, as we call it, the Strategic National Stockpile, or the MCM inventory, which is the medical countermeasure. They notify the team lead, different team leads that I mentioned earlier. They let them know that, hey, we're demobilizing, we're ready to close this pod. And at that time, the team leaders or unit leaders will hold a debriefing with their team. We call it also a hot wash. They discuss the success and area of improvement. They normally set up like a group huddle. They all sit together and discuss what went wrong, went right. Because during each pod operation, we like to learn from our mistakes. We like, if there's something that went well, we like to keep that and continue doing that. If there's areas of improvement, if you feel like some part of the operation, let's say the flow was not going as quick and you saw something, say it, say that during the hot wash, be like, hey, the flow was not going as quick. There's something was wrong. Maybe next time we need to do this, we need to do that, because those pod operations can continue for months and months. And every time we learn something, we fix it so we can get better and smoother for the next operation. And then the general pod staff will normally assist the pod facility staff in demobilizing or setting up pod for flow on pod. So normally the operation ends. Sometimes the next day there's another operation. So we normally get the pod ready for the next operation next day. So tips for participating in a pod. This is just general tips for you guys. Be proactive. If you find a problem before it starts, let them know. If you see something, talk, let your unit leaders know, let your pod manager know this is something is going on, and be proactive and talk about it. You have a responsibility there. Pay attention to if you're a unit leader, your supervisor, pay attention to your staff needs. If they need a break, give them the break. If they need to eat, if you see some PPE exhaustion, they're not breathing, they need a break to step outside, pay attention to those, because some of you MRC, you'll be a staff leader, you'll be a unit leader, you'll be a supervisor. So that's your responsibility to take care of your team and be transparent. Don't be afraid to get your hands dirty. If you see something that needs to be fixed, then you can fix it. Go ahead and fix it. Speak to your supervisor. Get into the operation. Get into the play. Be involved. We like you to be as one of us and part of us in this operation. Next. The pod safety and success in your hands. So it's your responsibility of each person to use the information they've been provided. So if you feel there is any hazard, anything, please report that to your unit leader. If you don't have a unit leader, or you are the unit leader or supervisor, report it to the Biosafety, to the safety officer. If you don't have Biosafety, you don't have a safety officer, report it directly to the pod manager. Be responsible. If you see anything, as I said, just say it. If you see something can be fixed, fix it. If not, just report it to the proper channel of command. Next. So safety consideration, as you all might know, you dial 911 if an event of medical emergency, provide CPR only if you're qualified. A lot of vaccinators are qualified CPR, so if you feel there is an urgent to do that and you're qualified, go ahead and do it. Inform your ICS supervisor and your safety officer of any injury, any safety issue that you see. And everyone role here is to look for PPE exhaustion. As I said, people um, they're not they're not used to wearing those PPE or mask, or if you see any signs or symptoms that the person is not comfortable, talk to your supervisor or make sure that person has been taken care of. And as I said, if you see something, say something. Right, I think that's all I have. So I might take a few questions.
Yeah, certainly. So I have a few for you, Lean, that have come into the chat. So first off, are some pods mobile units that go into high need areas? That's one question that has come up.
So we have what we call it a mobile, like a container that we can take. Some containers, some health department, they have those containers that they have all the pod supplies ready and have it stored there. So they normally take it to rural areas. But we plan for all Virginians to have a vaccine and or medical pills within 48 hours. So we have plan in place. We know where to find those population and we know where to go to get them, to get the vaccine to them or the pills to them. It depends on the type of pod. But we consider all scenarios and all people throughout the state of Virginia. As I said, we've been planning this for years and years, and we've been training and ready for it.
Definitely. And then there was another question too about, can open pods, do they also require appointments?
Open pod do not require appointment. You normally get, let's say at the local news or radio, you get an announcement saying, hey, there's an open pod from, let's say 8 o'clock to 5 o'clock. People can just show up and get their vaccine. And this is what we're probably going to do once we open the pod to the whole public.
Yep. And just to clarify right now, we are not in that place, and we'll be going over that in just a moment. And then just a confirmation for someone that was asking, I believe a gentleman named Rob was asking, to confirm, is a pharmacy or government center that's giving a COVID vaccine to a select part of the populace still considered to be a closed pod?
This is a closed pod. If you see that it's dispensing to a particular population, this is a closed pod. If they say this is only for certain type of people, like the phases that we're doing right now, these are all closed pod because they're very particular to a certain population.
And then let's see, there's a question, or really rather a statement that someone thought that even the non-medical support volunteers still have to take 2 FEMA courses. So I do want to just point out very quickly that some of our local health district units do require the ICS 100 and 700 courses. Some do not require it in order to work at a COVID facility and just recommend it. But the best thing to do would be to ask your local coordinator, and you can find that. I've shared that link, but we can certainly share it again in just a moment if needed. I've seen a couple of questions about live CPR training. You can take any adult CPR training in order to fulfill that requirement. Also, we've had some recent legislation that has passed that states that you only need to have had the didactic portion of the CPR, and it can be expired for up to 2 years past its expiration date for you to still utilize that. So at this time, we don't have very many codes left. So I will not be sharing the link to our scholarship program just because we have fulfilled that more than likely, and I don't want you to fill out all that without being able to actually apply. So just know that you can take any online CPR, adult CPR course at this point. And then there's a question, Lean, about the expansion of COVID vaccines to the local pharmacies and whether or not that's going to decrease the number of vaccines that are available through the health department through these closed pods.
No. So those MOUs or those agreements that we have with pharmacies, the pharmacies, they play a role similar to the open pod that we have. So we're gonna dispense the amount of the vaccines to those pharmacies so they can help us vaccinate the public. Right now, the pharmacies are actually vaccinating the long-term care facilities and nursing homes. So this is also an agreement with them that they can help us. The reason why we have those agreements, because us as a local health department, it's very hard mission to vaccinate everybody or give the pills to everyone. So that's why we go out to those different partners and we ask them if they can help us. So the reason for a closed pod also that we want them to help us by vaccinating their own people so they know that people are ready and safe, especially in those people who work in essential, like for example, the police departments, the fire. We send them those vaccines and medications so they vaccinate their own people. Also, for example, Dominion Power, these are essential personnel. We want them to be safe and ready and also continue the work. So that's why we have an agreement with Dominion Power, for example, that we send it to them. So when we think of a closed pod, we want that agreement to be in place because they help us. Once we get to that public, we already know that that particular population, if it's in a military base, if it's in a hospital, if it's in a healthcare facility, if it's with Dominion Power, if it's with the Pentagon, if it's in a department, we know those people are already vaccinated, so we can take that portion out of the vaccines for the public and continue giving the vaccines to the rest of the people that they haven't been vaccinated yet.
Excellent. So last question, and then we'll move on to more vaccine specific questions. The next question is there any proof of residency requirements for mass vaccine sites? I know that this has been a really hot topic, especially on the news lately, because people have been driving to other states to try and kind of break in line, so to speak, to try and get the vaccine, just because there's such a need, right? Of course, throughout all communities to try and get this vaccination. So Lean, if you can speak a little bit to how we kind of manage that.
So in Virginia, we require that you be a resident in Virginia because we collect information and we have a system that we enter all your information and you receive a card once you get that first dose. So we need you to be a resident of Virginia to get that vaccine. And the allocation that we get with the vaccines from the government or from those pharmaceutical companies, we give them the number of people that we have here in the state of Virginia. So we cannot really, I mean, we'd love to vaccinate everybody who comes by, but we care more about our people and we want to get everybody vaccinated here. I don't know if I answered that, but Megan, if you want to add anything.
Yeah, I would just say that once things are a bit more open, when we have a lot more vaccine flowing in and there's more open pods, that should be less of an issue. Right now, the main issue is because we have just a limited amount. So we are directly contacting people for appointments. You'll receive an email or you'll receive a phone call, etc., from your local health district that will allow you to make an appointment and follow up on that. And they will give you directions about where and when to show up if you are receiving those calls. So with that being said, I appreciate you, Adrenia, for moving the slide for me. Thank you so much, Lean. Continue to hang out in case we have any other pod questions, but I'm going to kind of get a little bit more into some of the vaccine specific questions that are coming in now. So next slide, please. All right, so obviously plans are underway, right, for federal and state levels for the COVID vaccine deployment. We have been finalizing a lot of specifics, and a lot of things depend on what the FDA is doing, depending on new vaccines that are hitting the market, et cetera. And then we also have a variety of pod models that Lean's talked a little bit about earlier that may be utilized. You could have a drive up depending on the area. Sometimes it's walk up, especially in Northern Virginia. I feel like more of ours are a bit more walk up in that area due to the locality and how kind of the roads and everything are made up here. And then for a variety of pod models, we will staff those accordingly. You know, we will obviously have more people in the parking lots or in the drive up kind of positions if they are a drive up model, et cetera. So MRC really serves a critical role in this vaccine administration and distribution effort. Some of our pod locations throughout the Commonwealth are either 90% or close to 100% MRC driven. And, you know, that is out of a need for us to continue to do the good work that we're doing at the health districts, along with utilizing your wonderful support and being able to scale up to help the community in such a dire need at this time. So next slide, please. So just a little bit of vaccine information. This slide has been updated a few times, so forgive me for the status portion. I have put in that the Pfizer and the Moderna have both been approved, but I wanted to share this slide specifically because of the storage and the administration portion of this. As Marshall talked about earlier when we shared that video, the Pfizer and Moderna are both mRNA type vaccinations, but they do have slightly different storage and administration, considerations as well. So Pfizer, as you've probably heard from the media and other sources, really requires that ultra cold storage where we have -70°C, and then once it is begun to be mixed and kind of taken out of that deep freeze, it can be kept in that 2 to 8 Celsius range for up to 5 days. Another differentiating factor is that it's 2 doses, but it's 21 days apart for the Pfizer. For Moderna, it's a bit more shelf stable. And in that it can be stored at -20°C in a kind of typical freezer, and then also can stay from 2 to 8°C for up to 30 days. It is also mRNA and is also 2 doses, but it is 28 days apart. So depending on which one you get started with in terms of those manufacturers, it may depend a little bit on how the administration is driven from there. So that being said, we're also awaiting, if you could go back to the last slide, please. We're also awaiting the Johnson & Johnson vaccine. They recently applied for EUA approval on the 4th of this month, and we are expecting for them to go in front of the FDA and make their case and, hopefully receive approval for the one-shot Johnson & Johnson vaccination on the 26th of this month. So more to come on that. That'll, of course, probably dramatically increase our bandwidth to be able to continue to vaccinate and, will allow us to have more vaccine in the market. So next slide, please. So just to show you a little bit about what the CDC vaccine distribution plan looks like, this slide has been updated slightly. So please, kind of dismiss the phase 1A and phase 1B, but I did want to kind of let you see what we kind of look at when we talk about the vaccine distribution plan. It really has to do with this very much of a roller coaster like diagram that we have in front of you here, where we're really working to scale up. So I would really say that we are fundamentally right there smack in the middle of that red circle or oval, and we'll be here for a certain amount of time until we have enough doses available. So we're really hoping to receive more as the Defense Production Act produces more, and we are able to receive more at the state level and therefore push that out to local health districts as well. So phase 1A, as you can see in the past portion of the diagram, is really covering both healthcare workers, but then also long-term care facility residents and those workers that work within those facilities. And then phase 1B, as we'll kind of get to in just a minute, has a lot of other essential workers, I know, and also people that are over 65 years of age. In our state, we are kind of splitting those two categories of phase 1B in the middle and trying to make sure that 50% of those 65 years and up are directed, vaccine, and then kind of putting those other essential workers into a separate category within that phase 1B, and 50% of that vaccine goes to those groups as well to try and prioritize it as best as possible for those that are at the highest risk of morbidity and mortality. So next slide, please. So as I kind of mentioned on the previous slide, this is what the phase breakdown looks like now in Virginia. And you can see that right now we are kind of in that phase 1A, phase 1B area. I should say that a commonly asked question that we've received is which phase are MRC in? Technically, if you are working at a vaccine pod, so not just MRC, but if you are working at a vaccine pod, you fall into phase 1A, but given the fact that there is limited amount of doses, we are telling you to check in with your local health district to see if there's availability of doses. Now, when you receive your doses, let's say you're working in a pod and you've signed up and you've done all of your training and they do have a vaccine available for you. Oftentimes this will be given out to you towards the end of the pod. We want to make sure that you don't have an adverse reaction or anything like that. So most locations are doing that. You can certainly check in with your local MRC coordinators to get more specifics on how they would be managing that vaccine for healthcare providers and make a determination. We completely welcome and respect your need to wait to be vaccinated. So please do understand that if you do not feel comfortable vaccinating right now due to not having that vaccine on board, we completely respect that. And please know that we will need people for a long time. This is not a sprint. It is definitely a marathon, and we respect your need to be able to volunteer safely. So please understand that we understand your needs there. So please just make the best determination for your own self and your own health. Okay. So, but as we get more vaccine, we're hoping to head soon into the phase 1C portion. But, as you can kind of see by that bar at the bottom where it says vaccine availability under that phase 1B, we're still kind of in that ramp up phase under phase 1B, trying to make sure that we get as much out to that phase 1B category before we open it up to a broader group of essential workers. All right, next slide, please. So I've already answered this first question, but again, our MRC volunteers who are working in vaccination pods, and I want to reiterate, who are working in vaccination pods are in phase 1A. So if you are doing a different deployment that does not necessarily have you working with the public, you may not be, fully in that phase 1A portion. But if you are in that public facing area, you are considered a healthcare worker. So keeping that in mind. And who all can be vaccinated in phase 1. We've kind of gone over that, but there's a little bit more about the vaccine priority groups, and you can explore that at this link. But right now, the phase 1 group really has to do with those long-term care facility residents, healthcare workers, and those are people who are working in healthcare or healthcare supportive roles that are public facing, and also healthcare worker long-term care facility, residents, and those workers that work in long-term care facility situations. All right, next slide, please. And then, so I know that we've had some people asking us where you can review a copy of the plan. So you can certainly access that here at the vdhvirginia.gov COVID-19 resources website. And that should show our whole comprehensive plan. And then also, there is often a question about pod locations and how they're already determined. As you've probably seen already in your community, there are some that are already determined. We've already got most of those underway. We have teams that go out and decide on those well in advance of opening up a pod to make sure that they are safe places for people to go to and to associate with, and trying to make sure that we can reach as much of the community that we're needing to serve as possible. So they are already determined, but they're not necessarily always public. So, of course, we do keep those private until we are ready to publicize those events, especially when we get into 1C. Those will be determined, based on when we're able to open those up to the public. Next slide, please. All right, and then we have some questions about the vaccine administration and how we're kind of entering information and data into the VIS system. So right now we're kind of using a mixture of two systems primarily our VAM system, which is our Vaccine Administration Management System. But we're also bringing on a new system called PrepMod that will hopefully handle our data a little bit better. I know that there's been some recent media regarding the lower level of the doses that were showing up as being given in Virginia. Some of that was a data issue, and we have since fixed a lot of those things. And we're hoping that through the use of PrepMod, which is an HL7 API, that we're able to better kind of address those data needs going forward. You'll also see, you know, as we talk about vaccines and things like that on social media, that people receive a kind of a CDC card that they keep up with too, and that's a secondary source of record as well. So, but VAMS and PrepMod do enter in directly into the VIS system, which is where immunization records are kept, and they do interface there to be able to show how many have been given. So far in Virginia, we've had about 1.2 million roughly vaccinations that have been given throughout the state. And in terms of how long immunization, this is determined based on when you have received the Pfizer or the Moderna, but really you should expect to kind of have fulfilled your full efficacy and immunity about 2 weeks or so after you've received your second dose. And just as a reminder, the Pfizer is 21 days apart with 2 doses, and the Moderna is 28 days apart with 2 doses. So for Moderna, it'd be about 6 weeks after, you know, you've started those doses, and then the Pfizer would be more like 5 weeks after for when you would expect to be kind of fully vaccinated, quote unquote. Next slide, please. So who can vaccinate? So this may change in the near future, but as of right now, this is the list of folks that can vaccinate. And this is also our link to Vaccinator training. And if Lean or somebody can enter that link into the chat, you can go ahead and kind of start reviewing over that. We do ask that you hold off on doing your training until you've been an approved volunteer rather, and that you've attended orientation and done some of those background check steps and things like that. But it is out there so that you can go ahead and see how much time and commitment there is in order to be a COVID-19 vaccinator for VDH and for the MRC. Next slide, please. There are some additional recommended trainings if you'd like to know a little bit more about PODs. So you can certainly go here and attend the POD Essential Overview training course. We do have some other trainings that we're working to bring up for you so that you can certainly explore some other things as well. But this one would be the most recommended right now. Again, it is not required. This training that you're attending right now is also not required, but is suggested just due to being helpful for you to understand the totality of a pod and what that should look like on your first day so that you can kind of get that understanding. In order to vaccinate though, those trainings on the last slide, if we can go back to that, those trainings are required. So just as a reminder, we do require additional training. We understand that you guys are fully competent, especially those who are our medical folks. We understand that you've been in practice for a long time, but we also want to make sure that we're doing things safely. These are emergency use authorized drugs. They do have specific, differentiating factors to them. Moderna, for example, cannot be shaken like you would typically shake a vial of vaccine. It has to be swirled in a certain way. So it has certain handling instructions and things of that nature that we just want to make sure that everyone is maintaining and giving that vaccination in the safest way possible and maintaining that safety across the board for our public. So that being said, I'm going to turn a little bit now to the questions and try and answer some of those. If for some reason we have not answered your question though, please do follow up with us. I apologize, the VAMRC email got cut off. That's vdh.virginia.gov. It's behind the picture, my apologies. But you can follow up with COVID-19 questions at our COVID-19 site. And then you can also follow up with the VAMRC for those questions as well. And we're happy to follow up. And then we'll also try and address a few of those in the last few minutes of our training today.
So Megan, you have a few questions in regards to vaccine. The first question, what are the 3-week number projection for vaccine availability for Virginia?
All right, so in terms of availability, it's hard to say right now. In terms of the 3-week, I will say that we're hoping to get more vaccine, especially in the oncoming weeks when the Johnson & Johnson vaccine is available, but it's hard to really predict that fully just because any vaccine that we get at the state level, we immediately send out to the health district. So it can be different from health district to health district what is available. So it may be a better question for that level, but really and truly, whatever vaccine we have, we are trying to make sure that we're getting out to either first dose folks or second dose people.
Okay, thank you, Megan. Another question is, out of medical personnel, can they vaccinate in Virginia?
I'm sorry?
Out of state medical personnel, if they have, can they vaccinate in Virginia?
That is a great question. So according to the PrEP Act, which is a federal act, people from out of state can vaccinate in Virginia. I will say that we currently have a bill that was put out by the General Assembly in Virginia that is being compared with the PrEP Act. So it is currently with the Attorney General in the state to see whether or not, out of state can vaccinate based on either 5 years or 20 years after their license has expired, et cetera. So we are currently, that is currently under review, but I would defer to the PrEP Act for now, which allows for out of state to vaccinate within Virginia. So if you need specific information about whether you can vaccinate, do follow up with us with that VAMRC email, and we can certainly follow up with you.
Questions about the first of all, a quick question about a lady who her husband can interpret, speak Spanish. We'll ask that you to reach out to your unit MRC coordinator, and then they can fill out an application and become an MRC for that role. If they want to play a role of interpreting, that's fine. We need all the interpreters and translators, so that'll be great. Somebody asked about if they can start the deployment without getting the vaccine, Megan.
Yeah, you can certainly be deployed without being vaccinated. As I mentioned before, many of those who are choosing to be vaccinated when they deploy, are vaccinated towards the end of working their first initial pod shift. So you can certainly choose to not be vaccinated too. We do not require vaccination in order to work at our deployments. But, if we have vaccine available, we certainly, do suggest it to you as well if it's available and we have enough for both the MRC and the public.
And the same question for the second dose. It's up to you guys. If you take the first dose and you want to start deploying, that's fine as well. We'll leave it up to you. But the well-being and your safety is #1 priority. So if you feel you're safe and you're okay to come into a pod without being vaccinated, we'll leave it up to you, but there is no requirement.
Yeah, and Blythe asked a question in the chat just now, and I'm going to post a link to the CVC tracker so that you can see kind of how many we have been able to vaccinate thus far in Virginia, and you can kind of see how that compares with other states throughout the union as well.
Okay, there's other questions about about the ICS courses. If somebody's just working logistic or admin, do they need to take more training?
If you're doing those other roles that are more general support, you aren't required to, but do know that it may be helpful for you too. So we do suggest it and recommend it so that you can learn a little bit more about the intricacies of what role you may be filling, but it is not required. And then also, if we can move forward to the next slide, just so everybody can see how that they can show their attendance for today. So just want to make sure that everybody has this part. It's one of the more important parts of our whole thing today. We want to make sure that you get your attendance. So if you want to go to the vdhvirginia.gov MRC roll call site, do not put in pod rocks in the chat, but you want to go to this site, and then you can use the secret phrase pod rocks to show that you have attended today's training. So with that, we can take probably one more question, and then we'll end today's session because we want to be respectful of everybody's time.
So Megan, if somebody has a question about their training, about their train account, about the VHS account, where they can, what's the email that they can use to getting that?
Yeah, so the best way to reach out to us for any questions about your account or any questions that you may have just general to MRC, you can reach out to us at that vamrc@vdh.virginia.gov. And that can be the way that you reach out. I do see a question really quickly about dentists, dental hygienists, and also vets are being considered as possible non-traditional vaccinators. That is with the governor right now, and we should hear back soon on whether or not that we will be expanding into those areas to have more non-traditional vaccinators join our vaccinator group. We are so looking forward to that day, but we're awaiting some legislation to be signed. There's several bills right now and executive orders that are pending. So once we hear back about those, we'll be sure to send out that information both to you guys and then also your MRC coordinators as well, so that they're able to message that out as well.
And if you have any question about a role that you want to be signing or a question about a training, reach out to your unit MRC coordinator at the locality. And normally the application takes about, I don't know how long does it take, but it depends from unit to unit. Normally they do a background check, take between 2 to 4 days, and then they'll start your application process, any training that you need to take. So within a week, you could be ready to be deployed if you finish all your training and requirements.
Right. And just a quick comment on that. So we have been working to supplement our group a little bit more so that we can make sure that our engine keeps running, so to speak. We've had over 7,000 new applications in the last 33 days. So let's just take a moment to be in awe of that amount of people that are willing to help out in the state of Virginia. That's amazing. We are so thankful for you guys all, coming on board. That has meant, though, that we have had to scale up significantly with our own staff to be able to meet those needs and be able to get those background investigations done and help out in the ways that we can to get you to where you need to go. Do know that there has been a bit of a bottleneck, and we wanted to make sure that we are addressing your needs to be able to help out and volunteer. So hopefully we'll get kind of back on track soon. We've been a little bit more delayed than normal with things like background investigations, but we do have folks in place now that we're able to assist in those processes. So please be patient with us as we continue to scale up. The governor asked for us at the beginning of all of this to increase our roles to 30,000, and I can report today that we have nearly accomplished that goal. We're nearing 28,000 volunteers, and that's just amazing and incredible. So we are so excited to have you guys be part of our core of volunteers, and thank you so much for everything that you've been able to accomplish and do for us. And then I will just, if somebody can add in the link for the roll call. It looks like we're having some folks that are having trouble getting to that link. We will stay on for just a couple of minutes, just in case you need to click on that to finish your attendance and get started today. But we so appreciate you coming today and letting us speak to you a little bit more about the MRC and mass vaccination. So thank you all.
Thank you all. We appreciate you. You all rocks, and we're looking forward to have you in those spots operations. Thank you. was a question about, do you need to wait for the background check to complete in order to be a volunteer? If you've been approved as a volunteer, that's mean your background checks have been already done. You don't see that approved as a volunteer if the background check is not done. So you're ready, you're good to go. Just check with your unit coordinator if you need to take any more training. Please contact your unit MRC coordinator if you're still kind of confused about the process, and see what the answer is, because it depends from unit to unit. Sometimes they do things a little bit differently. But from my understanding, if you get approved, that means your background check has been done. But you can reach out to them and ask them. The slides will be in our website if you guys need those slides. Go ahead. I'm sorry, Audrey.
That's okay. And also they can look at their VBH profile, and if there are a level 3, the background check has been completed. If there's still a level 4, it has not been completed yet. So it may be pending or waiting for results.
And where they can find this presentation or the recording, Adriana?
Everything will be posted on the training calendar. If they go back to the email that was sent out in the alert, the training calendar link is there, and they can see the recording with the slides posted.
Thank you.
Use your VBHS username on the roll call form.
Just giving it a minute or two and see if there's any last questions, and then we'll hold it up. So there's a question about submission, upload their CPR information. You find your level in the VVHS, actually, not the train. You will see there if you're level 1, 2, and 3, and 4. For the to upload your certificate, I'll post the email here again if you have any question in regards to that. Just give me a second, I'll post that email. All right, we thank you all, and be safe and well out there. Thank you all for attending today. Have a nice rest of afternoon. Bye-bye. Thank you, Veronica.